Today, we're going to be talking about partner inflicted traumatic brain injury. Every October is Domestic Violence Awareness Month. It offers us an opportunity to focus on how our health is impacted by our relationships. My name is Monica Gedkin. I am the Violence Prevention Coordinator with the Office of Disability, Injury, and Violence Prevention at the Iowa Department of Health and Human Services. The objectives in our conversation today are connected to better understanding the connection between intimate partner violence and traumatic brain injury, while increasing our ability to respond to survivors by taking a healing centered approach. Additionally, we will gain the ability on knowing how to refer folks within their community around the issue of intimate partner violence and traumatic brain injury. So let's start stuff off by saying, what is it? How do we understand what is partner inflicted brain injury? Today, we'll be sharing resources and information that was created by the Center on Partner Inflicted Brain Injury, which is out of the Ohio Domestic Violence Network. Beginning with terminology, it's helpful to understand what is a traumatic brain injury and what is intimate partner violence. A general way of thinking about a traumatic brain injury is it is physical trauma to the brain that is caused by some kind of an external force, best described as a blow, jolt, fall, crash, blast. Um, and we'll dive into that further as to how that relates into partner inflicted traumatic brain injury. So, intimate partner violence is a public health emergency. This is the dynamic of either a current or former partner or spouse causing harm and abuse. So, looking at um, intimate partner violence, it is anything that is physical violence, sexual violence, stalking, or psychological harm. When we take our understanding of traumatic brain injury and partner inflicted brain injury, we're able to understand that it's traumatic brain injury that occurs within intimate partner violence. And so these are examples listed by the Center on Partner Inflicted Brain Injury. Examples can include any kind of strike or hit to the face or head. That can be anything with being struck by an object or being pushed and having your head hit an object, being shaken severely, and then anything that contributes to the loss of consciousness or adds to difficulty with breathing. There's some incredible resources available. We have Iowa specific crisis information on the resources that we can hand out. And one of those that you see here is the Invisible Injuries, which is a self assessment to go over when your head's been hurt and to better understand what you can do in getting support. Additionally, when your head's been hurt while experiencing domestic violence, and a note for what's the difference between intimate partner violence and domestic violence. Domestic violence is terminology that is most publicly recognized because back in 1994, when VAWA was developed and signed into law, it was out of the Department of Justice, and the laws around domestic abuse and domestic violence are ones that became language within systems and settings. Intimate partner violence is the public health approach, which is not about um, the criminalization of, but more so, how do we address and prevent these public health issues, and how do we improve our understanding of health and health outcomes for folks who are exposed to intimate partner violence. It's also inclusive to dating relationships and other factors outside of the way that the law would read. So, this is another resource, expanding upon the invisible injuries. Um, it's not an additional resource, but it's part of the invisible injuries. So, going over your brain can hurt even if you don't have any swelling or obvious marks, scratches, or bruises. Very helpful to hear scenarios versus talking about it from a definition standpoint or a medical standpoint. Being able to say if your head's been hit or you've been hurt or punched or kicked in your head, neck, or face. Those are possible indicators that you may need additional support from partner inflicted brain injury. So, why does all of this matter? Why are we talking about the intersection of traumatic brain injury and intimate partner violence? Why do you think it matters? I'm going to give you a moment to pause and reflect on that. Why is it important and why does it matter? Now that you have had time to think about why partner inflicted traumatic brain injury matters, I'm going to share with you philosophically the space of quality of life, right? So, regardless of a person's disability status, their survivor status with intimate partner violence, or other lived experiences, every person, family, and community should be able to access quality, affordable services and support within their communities. And what you see on the right there is another resource that is a guide to wellness that goes over intentional coping and support mechanisms when you're a survivor living with a partner inflicted traumatic brain injury. If you would like to receive an electronic version of this with Iowa specific referral information, please reach out um, to me through email. My email is available at the end of the presentation. So, what are the components of how our health is impacted? There's both a health and behavioral correlation when someone has experienced the life adversity of intimate partner violence and partner inflicted brain injury. Multiple data sources share that exposure to violence is correlated with chronic disease. All right. So, as we're looking at this and we see national surveys, a variety of health conditions are directly linked with increased risk of having these conditions. And some of those include what you're seeing on your screen, but also heart disease, hypertension, asthma, chronic pain, GI issues, lower back pain, memory loss, headaches, difficulty sleeping, depression, diabetes, anxiety. Additionally, why this matters is um, the life expectancy for a person living with moderate to severe traumatic brain injury is 9 years shorter, according to the CDC's estimates. Sustaining another head injury while still healing from an initial head injury can be fatal. As injuries accumulate, so, traumatic brain injuries that are happening during the length of a 14-year relationship with a person causing harm, the likelihood of recovering dramatically decreases. What we're seeing from the National Violent Death Reporting System is that female intimate partner violence exposure, so a survivor, passes away 5.1 years earlier than male survivors of intimate partner violence. And then with racial inequities, we're seeing a loss of 9 years or more for those survivors. Additionally, 50% of female homicide victims in the US were murdered by a former or current partner. Research estimates that up to 60% of the prison population in the United States are living with a traumatic brain injury. So, what we're looking at here is acknowledging the complexity of how exposure to violence and traumatic brain injury contribute to di- diminished health outcomes. This is a part of the resources through the Center on Partner Inflicted Brain Injury. So these are things that help, right? So these are some of those components of healing centered and healing focused for folks living with partner inflicted traumatic brain injury. So things that help to support good quality sleep, um, not doing things that make a person feel worse, planning ahead, taking breaks, expecting things to take extra time, trying to avoid their head being hurt again when possible, safety planning, um, and then taking it easy and resting your brain and body when possible, not using a computer or phone screen for a few days after a head injury. And so these are really interesting components when we think about these are things that are helpful for folks living with partner inflicted brain injury. And then for us as community members and service providers, it's really that space to say, is there anything about my overall support, case management, my policies that could be changed or modified to be more accessible for folks and a higher quality for folks? So, this will move us into our call to action. What can you do about this? The first thing in every public health area is to educate yourself, utilizing resources that are credible and reliable. And I want to point you all, as we've talked about the National Center on Partner Inflicted Brain Injury, that's absolutely one of the first places that you'll want to go. Additionally, I wanted to share out Pink Concussions, which also talks about some um, information specific to brain injury, concussions from sports, violence, accidents, or military service, and what that experience is like for women and girls specifically. So check that out and see the resources that are available there to help further guide you in your understanding. Apply a cues intervention. And so, what this is essentially if someone is coming to me and I'm in a medical center and I'm screening for intimate partner violence, I'll have questions that I ask. Have you ever been hit, punched, kicked, or slapped? Or are you safe at home? And what we have learned through research um, with survivors and in medical settings is that those screenings get really low positive disclosures. And so, what we currently have is what's called disclosure driven practice, where you need to tell me that you're experiencing intimate partner violence in order to receive resources or referral about how your health is impacted by intimate partner violence. Through learning what we did in research under Futures Without Violence, we have an evolved version that's more survivor centered that is called CUES, which addresses confidentiality, universal education, and support. And so, what I'm going to share with you is really that space of how do we engage with people and really questioning how can we honor a person's dignity and autonomy as it relates to they're here for medical services and support. I'm screening them for a brain injury right now. It would also be a really good time to provide information about how their relationship impacts their health. And so, Futures Without Violence has safety cards. This is an example of one of the safety cards. They're wonderful. They are different than a trifold brochure. They are the size of a business card. And there's a variety of them that are available in multiple languages. And on the inside, it's more of a dialogue. Being able to say, in this example, in this safety card, um, do you often feel depressed or anxious? And so it's really that space of, if someone, yeah, sure. That conversation is more fluid, and you can use the card as a community member or a medical provider to start that dialogue. Um, you can also have these cards available in spaces that make the most sense for folks to be able to have access to them. But the business card size is great because it's discreet. If a person wants to take that with them, it's a different experience than having a big brochure. The ability, if they need to take it with them discreetly, they can put it behind their phone cover. They can, put it in their shoe. There's all kinds of places that you can fit a much smaller card than a large brochure. The other component of this is being able to say, we're not just giving it out to people who screen positive, that disclosure driven. This is really that element of, we give this information out to everybody. It is such a pervasive public health issue. We also give out a couple cards to every person because um, someone right? Friend, family member, someone at work, someone at church. Please help and share this information with others as well. That is really substantial in helping people get connected, because folks are more likely to talk with a friend or family member first, if they talk at all, when they're reaching out for support. This information about where you can go and get your safety card. So you go to Futures Without Violence, and I apologize for the text being overlapped on this slide. But the ability to go to Futures Without Violence and to purchase materials, because of grant funds, you will only need to be you'll only be needing to pay for shipping costs. And you can order as many items as you're able to, and adapt it for what is most relative for your local communities. The other great thing to do is practice empathy. So think about right now some of the structural environmental changes that you can make around policy, practice, or protocol. So if I'm a mental health provider, is it my policy, and do I have the influence or the ability to change it? um, that you get dropped if you miss so many appointments, or if you are unable to make an appointment, you have to pay a higher amount, right? So, if I were to practice empathy, I would do an audit and look over my policies aligned with best practices, in support of acknowledging that the individuals I'm working in service to are made up of survivors of violence who may have a diagnosed or undiagnosed traumatic brain injury. And so, is it likely that they are more likely to need to reschedule an appointment last minute, or to cancel an appointment, or to have that flexibility in their life? Yeah. Um, and so, if we adapt that and think about how can we be more empathetic, because Um, in 99% of intimate partner violence dynamics, economic abuse is also present. And so you will have someone who's a survivor who needs to be seeing their therapist, who has to cancel their treatment because they can't afford it. And um, the ability to show up in that setting is very important, to have flexibility in how you engage with your clients or your consumers. Additionally, When you are working with folks, are you providing resources that are broken down into smaller steps? That's really vital as it relates to folks who are surviving intimate partner violence, who have past experience with it, especially if we go back to the mental health and the health of someone who's living with these experiences. Someone is fatigued, chronically exhausted, dealing with anxiety, depression. And so, cognitive impairment, memory loss. And so, having a task sheet where it breaks it down into smaller tasks, you're going to be providing a higher quality of care and support to those folks. And then another tangible example is finding ways of providing economic supports to families. That's identified in the CDC's Preventing Intimate Partner Violence Across the Lifespan Technical Assistance Package, in ways that you can improve the general health of your community, directly linked to that intimate partner violence. Another really great example is adapting your case management. So if you're a program that's providing case management, what parts of the program benefits are tied to the ability to follow through with something, right? So as you're doing your policy, practice, protocol audit, it's the ability to say, folks living with a traumatic brain injury, folks living with partner inflicted traumatic brain injury have a difficult time with following through. And this is not something that they can control. These are components of their lived experience with having a traumatic brain injury. Their brain is impacted. And so you need to think of this in the same way that provide support around language access for folks, right? Thinking about how your accessibility plan includes brain injuries and the social and behavioral um, symptoms and experiences of those living with that public health condition. In closing, I wanted to share that partner inflicted traumatic brain injury is common. There are a plethora of data and research that's come about definitely within the last decade, that has really gained momentum in understanding the connection between traumatic brain injury and intimate partner violence. So, for additional resources and information to pass out and to share in your community, please reach out to me through my email and state interested in receiving more resources. We have, again, that Just Breathe Wellness Guide. We have resources for identifying partner inflicted brain injury and those health safety cards. Thank you for your time and for your interest in improving health outcomes for persons exposed to intimate partner violence and traumatic brain injury.